You made it through nursing school. You made it through your graduate program. You completed your clinical hours. And now there is one final milestone standing between you and your PMHNP license, the board certification exam. For a lot of people, this is the most anxiety-producing part of the entire journey. And honestly, that makes sense. You've invested years of your life and tens of thousands of dollars to get to this point. The stakes feel enormous. But here is what I want you to hear before we get into anything else. The PMHNP board exam is absolutely passable with the right preparation, the right timeline, and the right strategy. You can walk into that testing center feeling confident and walk out certified. In this video, I'm breaking down everything you need to know, the 2 exam options and how to choose between them, what is actually tested and how the exam is structured, and the study strategies that actually work. Let's get into it. ANCC versus AANP. 2 exams, 1 goal. When you graduate from your PMHNP program, you have 2 options for board certification. The ANCC PMHNP-BC, offered by the American Nurses Credentialing Center, and the AANP PMHNP-C, offered by the American Association of Nurse Practitioners. Both exams certify you as a psychiatric mental health nurse practitioner. Both are recognized by state licensing boards across the country. Both are accepted by employers in every clinical setting, and both require renewal every 5 years with continuing education. So from a licensure and employment standpoint, they are both equivalent. The choice between them comes down to format, content emphasis, costs, and which one your program prepares you for most directly. Let's break down each one. The ANCC PMHNP. This exam is more commonly taken of the 2 exams. If you ask most PMHNPs which exam they took, the majority will say ANCC. Here are the specifics. The exam consists of 175 questions total, 150 of which are scored and 25 are unscored pre-test questions. You will not know which questions are scored and which ones are not, so treat every question equally. You have 3.5 hours to complete the exam. The passing score is a scaled score of 350 out of 500. This is not a simple percentage. It is a scaled score that accounts for question difficulty across different versions of the exam. The content domains tested on the ANCC include clinical assessment and diagnosis, psychopharmacology and treatment, psychotherapy and evidence-based interventions, professional and ethic practice, and health promotion and disease prevention. The exam also includes a small percentage of questions on nursing theory and professional issues, which reflect its nursing-specific credentialing body. The cost is approximately $395 for ANCC members and $495 for non-members. ANCC membership is $95 per year. So if you're planning to take the exam, it may be worth becoming a member first to save on the exam fee. The AANP PMHNP-C. This is the newer of the 2 exams. It was introduced in 2016, and it has been growing in popularity steadily since its launch. The exam consists of 150 questions, and you have 3 hours to complete it. The content is considered more clinically focused than the ANCC, with less emphasis on nursing theory and professional issues and more direct emphasis on clinical decision-making and patient management. The cost is approximately $315 for AANP members and $415 for non-members. AANP membership is $95 per year. Again, worth considering if you plan to take this exam. The AANP exam is widely respected and fully equivalent to the ANCC for licensure and employment purposes. Some candidates report that the more clinical focus of the AANP exam feels more aligned with what they learned in their programs. But this varies significantly by program and individual. Which one should you take? This is the question everyone asks, and the honest answer is ask your program first. Your PMHNP program prepares you for a specific exam. Most programs align their board review content, their practice questions, and their board prep support with either the ANCC or the AANP. Find out which one your program primarily prepares graduates for and start there. Beyond that, here are the deciding factors. If you want the most widely recognized credential and the largest community of board prep resources, the ANCC is the more established choice with more available study materials. If you prefer a more clinically focused exam with a slightly lower cost and you have a strong clinical foundation from your program, the AANP is an excellent option. If you're still genuinely undecided, the ANCC is the safer default simply because of the volume of prep materials available. More practice questions, more review courses, more study guides have been built around the ANCC exam because it has existed longer. Either way, once you choose, commit fully. Don't split your time studying between both exams. Pick one and prepare for that specific exam with intention. Eligibility requirements. Before you can sit for either exam, you need to confirm you meet the eligibility requirements. Let's cover the basics. For both the ANCC and AANP, you must hold a current active RN license. You must have graduated from an accredited graduate level PMHNP program, which is why we spent so much time in the last video on choosing an accredited program. You must have completed the required clinical hours, 500 minimum for MSN graduates, and some programs require more, and you must have a focus in psychiatric mental health nursing at the graduate level. The application process for both exams involves submitting your transcripts, verifying your clinical hours, and in some cases, having your program director sign off on your eligibility. Processing times for applications can take 2 to 6 weeks, so factor that into your timeline after graduation. What's actually tested? Let's talk about the content, because knowing what's actually on the exam is the foundation of an effective study strategy. Both exams test knowledge across the full scope of PMHNP practice. But if you want to know where to focus your study time, here is the breakdown by content area. Psychopharmacology, which is one of the most heavily tested domains on both exams. This includes drug classes and mechanisms of actions, clinical indications, side effect profiles, contraindications, drug interactions, dosing considerations, and clinical decision-making around medication management. If you invest study time in nothing else, invest it here. Psychiatric assessment and diagnosis covers the DSM-5 diagnostic criteria for all major psychiatric disorders, differential diagnosis, mental status examination, safety assessment, and the diagnostic tools you use in practice, such as the PHQ-9, GAD-7, Columbia Protocol, CAGE-8, Audit, and others. Psychotherapy and evidence-based intervention. This covers the major therapeutic modalities: cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, supportive therapy, and psychoeducation. You need to know the indications, the techniques, and the evidence base for each. Lifespan considerations. This covers psychiatric presentation and treatment across the lifespan, child and adolescent psychiatry, adult psychiatry, and geriatric psychiatry. Each population has distinct clinical considerations, and both exams test this material. Professional and ethical practice. This covers scope of practice, prescribing authority, documentation, healthcare law, ethics, consultation and referral, and professional standards. Building your study plan. Now, let's talk about how to actually prepare. Here is the study approach I would recommend. Start studying 3 to 4 months before your exam date. Not 2 weeks before, not 1 month before, 3 to 4 months. The PMHNP board exam covers an enormous breadth of content, and that content requires time to consolidate. Cramming simply does not work for this exam. Week 1 of your study plan should be dedicated entirely to assessment. Take a full-length practice exam before you study anything. Not to see if you're ready, because you're not, but to establish your baseline and identify your weakest content areas. Your lowest scoring domains become your highest priority study targets. Study pharmacology every single day, not some days, every day. Build flashcard decks for every drug class. Review mechanisms of actions, indications, side effects, and contraindications until they feel automatic. This daily repetition is how pharmacology knowledge becomes clinical instinct. Dedicate structure blocks to each content domain. Spend focused time on DSM-5 diagnostic criteria. Know every major disorder well. Build a reference sheet of the diagnostic tools and safety frameworks you'll need to recognize on the exam. In the final 4 to 6 weeks before your exam, shift your focus heavily to practice questions. Aim for 50 to 100 questions per day. Don't just check whether you got the answer right or wrong. Read every rationale for every question, including the ones you got right. Understanding why an answer is correct is as important as knowing that it is. Best study resources. There are several board review resources that are consistently well regarded in the PMHNP community. Here are the ones worth knowing about. Fitzgerald Health Education. This offers a comprehensive PMHNP board review course that covers both the ANCC and AANP exams. It is one of the most widely used and respected review courses available. Barkley and Associates. This offers another well-regarded NP board review program with a strong pharmacology component. Blueprint Test Preps. This offers an adaptive question bank with detailed rationales. If practice questions are your primary study method, Blueprint is worth looking at. Stahl's Essential Psychopharmacology, which is the clinical pharmacology reference for psychiatric prescribers. If you want to truly understand the pharmacology you'll be tested on, not just memorize it, this is the book. The DSM-5 is your diagnostic Bible. You should have a copy and be comfortable navigating it before your exam. APNA, the American Psychiatric Nurses Association, also offers board prep resources and study guides specifically for PMHNP certification. Exam day tips. A few practical notes for exam day. Know your testing center location in advance and do a practice drive if it's somewhere you've never been. The last thing you need on exam day is navigation stress. Arrive early. Give yourself at least 30 minutes before your scheduled start time. You'll need to check in, present your ID, go through security, and get settled before the clock starts. Read every question carefully and completely before selecting your answer. Many exam questions are designed to test whether you can identify the most appropriate intervention in a specific clinical context, which means the details matter. When you encounter a question you're unsure about, don't freeze. Make your best clinical decision. Flag it if your exam allows, and keep moving. You can return to flag questions if time permits. Spending 5 minutes on one question you're unsure about is not an effective use of your exam time. Trust your preparation. The knowledge you built over months of studying does not disappear when you sit down at that computer. Trust what you know. Key takeaways. The board exam is challenging, but it is absolutely passable with consistent strategic preparation. Thousands of PMHNP pass it every year, and you can too. If you want the complete picture of the PMHNP journey, from choosing your degree and program all the way through licensing, credentialing, salary ranges, and landing your first job, I put together a PMHNP Blueprint Complete Edition. It is a comprehensive reference guide built specifically for PMHNP students and practitioners. The link is in the description below. And if you're not ready for the complete edition yet, the free Quick Start Blueprint is also linked in the description as well, which is a great starting point. Subscribe to the channel to stay up to date with all of our psychiatric series. I'll see you in the next one.